Welcome to the CURES Show, where we explore the cutting edge of wellness for our mind, body, and spirit. So much of our mental health can really depend on understanding how our brain works, and for our kids, understanding them. But understanding ADHD, particularly when it comes to children, can be difficult to do. It's a topic that's come up a lot in our Channel 3 Mom Squad. So we wanted to bring this to a child psychologist about what do you do if you suspect your child has ADHD. So joining us now with more on this is Dr. Laura Saunders. She is a child psychologist at the Institute of Living. It's a premier organization right in Hartford, and certainly has dealt with this for many, many years, so she can really help us. Thank you for being with us, Doctor.
Thank you for having me, Kara.
So let's start with a new study that shows it's really important to get early intervention. And so that's why we really want to know what ADHD looks like.
Yes, so some recent research came out, put out by the American Psychological Association, showing that children who struggle with attention and behavior problems tend to end up earning less money, finish fewer years of school, and have poor mental and physical health as adults, compared to their kind of young people that don't show those same difficulties. And again, this was research done in the United States and the United Kingdom, which replicated findings pretty closely from New Zealand from about 12 years ago. So the concern is that, you know, once a study's replicated, it shows that it really has veracity. And so that's the bad news, right? But what we know is that children who struggle with inattention, hyperactivity, impulsivity, they have needs that also need to be addressed. And so the good news is we can do things early on to address those needs and get them support and intervention so that it doesn't have those same negative outcomes.
Yeah, I mean, so let's talk about that. Why is early intervention so important?
There are three core deficits in attention deficit hyperactivity disorder, or ADHD. Inattention, impulsivity, and hyperactivity. Those are three core deficits. And we can also talk about the difference between girls and boys, the difference between ADHD and the non-hyperactivity component. But when you look at the deficits in those three areas, what you need are skills in order to compensate for those deficits.
Mm-hmm. So some of the symptoms might be disorganization, poor time management, low frustration tolerance. So that's all stuff that can really affect school. And so your concern would be, without early intervention, they might start having really negative experiences in school.
Yes, right. You know, I always have this little litmus test, like 100 years ago, what did these people, you know, this is not a brand new phenomenon. 100 years ago, 200 years ago, 1,000 years ago, what were these individuals like, right? They were the skilled hunters in the tribe. They were the farmers that were out doing physical labor, burning their energy. They were working in a factory, moving fast, doing things, right? So we've evolved as a society, and now we really want to focus on STEM, science, technology, engineering, and math, right? And so those areas really do require higher levels of attention, focus, delay of gratification, and skills that are harder for those individuals who have core deficits.
Yeah, and there's a lot of benefits to some of there's, you know, I know one of the things that's come out in a lot of communities that talk about ADHD is, hey, there's they tend to have a lot of energy. They can be really creative. They can see patterns. There's a lot of famous people who say, like the guy who founded JetBlue, that says, I don't think I could have done this if I didn't know how to think outside of the box. So I'm going to thank my ADHD for that. So you're not trying to say, oh my gosh, doom and gloom, but the point is the better we understand this and the more you get kids what they need, the better their lives can be later?
Absolutely. So there's two kind of different factors I want to highlight. Number one is your point, which is intervention. diagnosis and intervention is critical, because a lot of times young people who then become young adults and full adults always feel like, I feel like my brain works differently, or I feel like my mind works differently, and have to actively learn and do things to compensate. But that's a lot of extra work without sort of an official diagnosis and someone to teach you skills. The other thing to keep in mind, and this really goes for any issue, but it's, I think, really prevalent for significant attentional disorders, is the presence of protective factors. So there are protective factors that make any intervention work better. There are protective factors that just lead to better outcomes. And then protective factors are not always things that we have control over. Examples are family support or family resiliency, internal motivation, or those individuals that are driven. Intelligence is a protective factor. Those individuals who are brighter and have higher levels of intelligence, that's a protective factor. So those are just a few different protective factors. Socioeconomic issues are a protective factor. So there are things that are protective factors that we don't necessarily have control over, but we can emphasize as a way to improve outcomes. But in any situation, early intervention and intervention that provides accommodations in school and support in order to gain skills is always going to be most helpful.
So we'll talk about some of those things that you think work, but let's start first. Some folks have asked in the Mom Squad, if you do suspect your child has ADHD, what do you do to get that diagnosis?
You can always start with your pediatrician. All children are connected to a pediatrician. Most children are not connected to a psychologist. And I know school's out now, but you can also ask your school support personnel. I always love to ask teachers. Teachers have an amazing ability to look at a child's functioning, academic functioning, social functioning, and have it as a developmental comparison, because whether it's your first grade teacher, your third grade teacher, your eighth grade teacher, whatever, they have years and years of developmental comparisons to say, you know what? Yes, your child might struggle a little bit with inattention. However, I don't think that it's developmentally outside the range of typical. I think they're going to be okay. Now, that doesn't mean you can't go and get an evaluation, but teachers have an amazing amount of experience and can really put things in a developmental context based on their years and years of experience. So I ask other people. I mean, you can check with your pediatrician. You can check with your school support personnel when you're in school. You can ask your child's teacher, do you think my child has an attentional disorder? Do you think my child's level of impulsivity is really different or far exceeds other children? Do you think my child's level of activity, motoric activity, is really outside the range of typical? I'll give you an example. So in my private practice, I've over the course of my career, I've seen hundreds, I dare to say even thousands of young people, right? And so when a young person comes into a strange office, they're often more quiet. They stand by their parents' side. They don't really say much. You have to kind of engage with them. I had a young person come into my office one time. He came in and immediately he played with this toy, then he played with this toy. Within 5 to 10 minutes, the office was a wreck. He had played with 10 different things, didn't play with anything for more than like 30 seconds. And I looked at the mom and I go, this child has a pretty significant attentional disorder. She said, I was wondering if that was the case. I mean, because I could tell you from all these experiences that I had, that even if it's a lot of kids have an attentional disorder, very often their behavior looks, like they stand quietly by their mom's side. And this child did not. So you're always looking at sort of points of comparison to help you.
Yeah. And sometimes the teachers are going to come to you. I think where it gets a little tricky, and this is another question that moms have been asking in the book, this is another question moms have been asking in our Mom Squad Facebook group, but how does it present differently in boys and girls? Because there's a lot of talk that sometimes girls get missed. They don't display the same hyperactivity.
So that's true. It is more common in girls that they will have they will not have the hyperactivity component. So they'll have the attention deficit disorder without the hyperactivity component. So because they don't have that hyperactivity component, it tends to get diagnosed later. So it's pretty obvious in elementary school and early middle school. Those children with the hyperactivity component are very obvious. Their behavior tends to be disruptive. They're getting a lot of negative attention. Sit down, stop tapping your pencil, don't throw that, stop talking to the person next to you, right? They're getting tons of negative feedback. For those with the without the hyperactivity component, you tend to see it later. So later in middle school and high school, where organizational issues are more important. So in like 6th, 7th, 8th, 9th grade, that's when the multi-stage projects, the longer term work happens, and the higher, you have multiple classes. You have 5 to 7 classes in a day. So you have to have the book and the notebook, or now it's a laptop, but you have to have higher organizational issues in order to deal with those organizational demands. So that's when we start to see the individuals without the hyperactivity component, because they have the inattention and they have the disorganization, but it becomes much more apparent as those academic demands change.
Mm-hmm. And to be fully transparent to our listeners, I definitely have dealt with ADHD in our own family and seen it present in different family members in very different ways. So, but the learning of the skills, there's even something called they have educational therapy, where it's like just therapy for school, and they teach a little bit more of organizational skills. Like, what do you think kids should be doing between therapy and medication to help with these interventions?
I always think that we can start with skill development. We can start with, improving your ability to focus, improving your attention, and your ability to breathe and sit in your seat and not blurt things out, right? So the two most important factors, I think, when we deal with younger folks in ADHD is working on their impulse control and their frustration tolerance, their ability to tolerate frustration. And if you think about the school day is filled with new experiences, which often cause frustration. So you try to work on frustration. Sometimes I call it distress tolerance. The ability to build in better frustration tolerance, tolerating distress, really working on the ability to control impulses, not blurting out, not jumping out of your seat, not tapping your pencil, not saying something to the person next, right? Not doing all those things that are going to be considered disruptive in a classroom, and then are going to get that individual a lot of negative feedback. Stop doing that. Sit down, talk quietly, don't throw that, get back in your seat, right? All those, and I understand they need that feedback, but all that feedback, it comes off as negative feedback. And then they start to tune it out. So now they're just like in their own internal world. They've kind of tuned out the feedback because it's coming in as negative feedback. And then that's what creates a lack of investment in academic experiences.
Yeah, so it would be wonderful if everyone could go sit in Dr. Saunders' office. But if they can't, and they're saying, and I know even just getting access to anyone can be difficult right now, what are some strategies for that? What can parents do to teach their kids some of the skills you just mentioned? Like, let's start with, how would you teach frustration tolerance?
Well, we often talk here about, like allowing your kids to have failure experiences, allowing problem solving, not trying to fix it for them. So it could be a puzzle, it could be a word game. I mean, I don't love video games for this kind of stuff. Because video games are highly stimulating. So it's pretty common that when you give feedback to a parent and you say, listen, I really feel like your child has an attentional disorder that's really outside the range of typical. And the parent says, my child can sit in front of a computer and play video games for hours at a time. And that's actually true. But video games are highly stimulating, highly reinforcing activities where you're constantly doing something. It's something new. The character's moving. So it's not a good way to assess a true activity level, but allowing them to do things, honestly, it's the summer, get outside, be active, be physical, learn to burn off your energy. Look, some of these kids might not be the bookworms that are just going to spend all their times doing academics.
Mhm.
They are the kids that need more breaks, right? They might need, they might need to exit the classroom and just, walk to the bathroom as a way to, and come back as a way to just take a break, clear their mind, move their body, right? So knowing your child and knowing what works for them in a setting that is really not built for kids with severe attentional difficulties.
Right, right. And in that, again, with the girls, you may not notice that as much, right? They might be able to sit, and maybe our culture, the way they behave, and they might be able to please more than a child who that has more of the hyperactivity component. I guess it's important to also let these kids know, hey, this isn't your fault. Your brain works differently, and there's some strengths to that and some weaknesses, but we want to work with you. And so that means you're getting that 504, that IEP. So parents are like, okay, how do I get that? First step, you might want to get that diagnosis from the pediatrician, and then what? You go to the school and say, I want to have a meeting?
Yes, you go to the school and you say, listen, my pediatrician gave some self-report measures, and it seems that my child is coming out high, but I want to get some collaborative information. I want, as a school, can we get some initial testing done? Usually that requires some formal requests. And because you want, I always like to get multiple data sources in order to really confirm a diagnosis. And there are times where intervention in school, intervention and accommodations, right? The intervention is, this is the diagnosis, we need to kind of do things differently. The accommodations are usually designed specifically for your child to allow them to succeed in a way that really brings out their strengths.
Yeah, and focusing, I mean, I know you talk about all the time trying to focus on constructive praise and minimize the negative feedback, but these are kids who really soak it up, like telling them, hey, I really like how you remembered to raise your hand, or whatever that is. Like, that can go a long way in helping them develop those skills.
Reinforcement of positive behavior is a far greater way to promote overall positive behavior than consequences. The more we can find our child doing the little things that they're doing well, right? Wow, you were just sitting quietly for a couple of minutes while I was on the phone. Thank you. Right now, they might not have been quiet the entire time, but you have to find the little pieces of behavior to reinforce, and the greatest thing you give as a parent is your time and attention. So you give them your attention. I noticed that you shared with your sister very nicely, and I appreciate that, right? So it's noticing things that are pretty concrete, not like you're great, you're special, those kind of things, because that just those compliments just bounce off because they're not as meaningful.
So there's a lot of questions about medications, and I know, let me preface, I know you're not a psychiatrist, but you do work with them at the Institute of Living, and for some, these medications can be game changers, but that's such a big decision for parents. So what can you say about parents who are wondering, okay, I don't know, should I medicate my kid?
You're right. So I'm not a psychiatrist. I don't prescribe medication, but I have done a tremendous amount of work, and there's a lot of literature out there in regards to medication. So I want to say a couple of things. Number one, some of the medications used for ADHD are some of the longest studied research medications in all of the areas of certainly mental health for children. Number two, I've heard parents say countless times, I don't want to give my child medication because I don't want them to either get used to drugs or use it as a crutch. And what I will share, from the research and from my clinical experience, is that the two things that medication helps with are the two things that I mentioned earlier on. It helps with impulse control and frustration tolerance. And if you don't, as you go through childhood and adolescence, develop some amount of impulse control and frustration tolerance, guess what you start to turn to when you become a teenager and you don't have impulse control and frustration tolerance? You turn to substances, you turn to alcohol, you turn to marijuana. These individuals find ways to mediate those impulses. If it's not through medication, and I know all medications have side effects. If it's not through medication, they will begin to self-medicate. And that is what the research shows, is that individuals who don't develop skills, and again, there are other ways to develop skills besides medications, but medications can be a game changer for a number of these individuals. But they need to develop the skills around impulse control and frustration tolerance, because I'm telling you what my experience shows and what the literature shows is that they will turn to substances later on to manage those symptoms.
Right, the clinical research. And I'll just throw out there, I'm a mom who's been through this too, and someone who does a lot of holistic medicine, so have certainly didn't want to do anything in my family until, but I've been able to talk to great minds like you, and I have noticed, at least in our case, it's been a big difference. So pills and skills together. I think you explained this to me one time, that allowing your child to have that period of time with medication, if it works for them, and we got to, the doctor will decide if it's appropriate, but that allows them to kind of slow down and then learn the skills better.
Right. Very often, especially kids, who are motivated and bright, right? Some of the protective factors we talked about, they want to learn, but they're not necessarily going to be able to sit and listen. And really during COVID, when learning was remote, these kids really struggled, right? Yeah. Because the act of playing a video game is so much more stimulating than sitting and listening to your teacher on a screen. These kids really suffered and struggled. So the more we can find ways for them to build those skills, find that academic experiences actually can be positive, and allow them to find what their passion is, what their niche is, what really interests them, and allow them to pursue those things, that's when we create more positive associations around academics, and then it's more likely for them to continue on. Mm-hmm.
And when it comes to, I guess the first step, just to go back, of what some of the things that you might be asked to do, and parents who are listening, they can Google this now. You might fill out a Vanderbilt form, and they would generally have you do that with the teacher, with your family, with your other caretaker if they are. So that's something I know parents can bring up right now, and just, even bring it into the school. Different schools might suggest, here are the forms, and other ones you might have to be able, but you can get a Vanderbilt form and a Connors form. Is that usually where people will start in the younger years?
Yeah, they start with those self-report, and again, pediatricians have access to those. Also, pediatricians, are frequently the ones who can prescribe medications, and usually it's stimulant medication, which seems contradictory, because why would you stimulate someone that's already hyperactive? But what they find is that there's actually underactivity. This is a very overly simple explanation. Underactivity in certain parts of the brain, so the stimulant actually stimulates those areas, and so it makes them better able to focus. That's a very rudimentary explanation. But so pediatricians can prescribe. You don't necessarily have to go to a child psychiatrist, because, sometimes finding a child psychiatrist or a nurse practitioner who specializes in children and adolescents for psychiatric reasons, they're very, very hard to find. So, or hard to get an opening. So your pediatricians can be actual lifesavers in these situations.
Yeah, and pediatricians, I know, most of the time are pretty good at diagnosing, and pretty good at least at prescribing some things. And then if they feel like they need some specialized treatment, they might be able to refer you to a psychiatrist who maybe have a better shot if they're referring you. But I know there's also a lot of online, and I'll just ask you that way here. There's so many ads right now about doing online therapies and getting, the Surgeon General actually said one of the reasons there's an Adderall shortage, which I know the ADHD community came out and was kind of upset about, that it might be being overprescribed, and there's all this online telehealth now. So some say this is a real issue, and it's not overprescribed for the people who are taking it. But what do you think about people going online to, say, these better therapies or whatever, and trying to get a diagnosis that way?
All right. So while one of the positive things that came out of COVID is telehealth, right? 3 years ago, I never, ever, ever did telehealth. There was no such thing,
right? Really.
And so things that we can do to improve access to care and reduce barriers, right? Reduce barriers to getting care are always helpful. In my experience, I do feel like when you work with children and adolescents, especially, that is therapy that needs to be done for the most part in person. Now, adults who have different life experiences and have the ability to attend and sit and self-reflect, that's different. But very often with children and adolescents, doing therapy, if someone needs to be in therapy, doing it in person, or at least a good part of the time, you might have to go remote occasionally, is really the way to go, because there's so much that you miss from, I think, a therapeutic standpoint when you're just looking at someone from a screen.
Yeah, and there are some qualified sources. I guess I remember doing some other interviews at CCMC. They recommended, I'm just going to throw this out to our listeners, that you get the book Smart But Scattered, that you subscribe to Attitude Magazine, ADD-itude. I think there's CHAD, there's more. So you want people to definitely educate themselves as much as possible, because this is not just, people used to think, oh, ADD, and they'll joke, oh, I have a little ADD. No, like, this is a real thing, and the way it all manifests, understanding that can be super helpful, especially as a parent, right?
Yes. Finding and also finding well-documented resources, right? I mean, I always say you can find anything on the internet. If you want to know about Martians that live on Venus, I'm sure there's a site for them, right? So you have to go to well-documented sites of major medical centers, or organizations like CHAD and other things. So not just to get pieces of information from random sources. One of your Mom Squad folks also wrote in about the difference between anxiety and ADHD. So I just want to comment on this for a moment. I think it's a really, really good point, because children who struggle with significant anxiety can look like they have inattention. And in fact, it is inattention. The difference is understanding what the source is. Now, you can have what we call like a generalized anxiety, where the anxiety, that is kind of hardwired more in the individual. And then there's more specific anxieties that you're anxious about certain situations. But in those situations where you see that your child's, having difficulty functioning in whatever setting, it would be good to find a professional to rule out, is this an underlying anxiety disorder, or is this an underlying attentional deficit disorder? Because the treatments are going to be slightly different for those things. And then if you're going after medications, the medications are definitely going to be different. So understanding the source of that is important. Is there factors that are driving someone's anxiety? Is your child sort of predisposed or vulnerable to anxiety? That's slightly different, although it may look similar. So that's why you have to be careful.
Dr. Saunders, there's so much information, and we so appreciate you answering some of the questions. I really encourage parents out there to learn as much as they can. And if you have those suspicions, advocate for your kids, try and get the diagnosis. I know your point today is early intervention matters and can really make for happier, more successful kids. So we appreciate you being with us today on CURES.
Knowledge is power.
Absolutely. And for everyone watching, thank you so much. You can share this on social media. I'm at Kara Sunderland. Have a great day, everyone, and be well.